Thank you, Mr. Chairman, and thank you, gentlemen, not only for your comments this morning, but just your leadership in this. I take particular interest in this discussion about vaccines because Alaska has lagged historically in terms of our vaccination rate. We have chronically been last among the 50 states. It's my understanding that we are in there at about 74.2% compared to all the other 50 states. Other states, you know, you've got some, Massachusetts is the highest at 92. So Alaska has a long way to go, and unfortunately, we've been this way for a while. So when we talk about vaccine hesitancy in Alaska, we know we get it, and so I'm very concerned about where we are moving forward with this vaccine. I also recognize that we have some of the most vulnerable populations in Alaska with our Alaska Native people. We have limited healthcare facilities. You've had opportunity in this hearing to hear all about it. So we are exactly the type of state that needs to have that assurance that, yes, this vaccine is going to be safe, that this vaccine has not been subject to political initiatives that would speed it up in any such way that would cause it to be less effective. We have every interest to make sure that there is an education campaign that people can believe in. I have been working with several of my colleagues on this committee, Senator Braun, Senator Hassan here, on the SAVE Act. This is the safe authorizations for vaccines during emergencies, basically making sure that we are ensuring a level of public, independent, expert review of the vaccine candidates. I know you may not wish to comment on specific legislation. Dr. Collins, you've already spoken in your initial remarks to the chairman and to the ranking member about the assurance that we must, in fact, make sure that, that this process that we have is true, is honest, and is going to result in a level of trust and credibility. I would just ask you to help me in encouraging Alaskans on, and other Americans on how we build this trust for a vaccine. What can you give me? Do we need more than just the SAVE Act here? To build that credibility and trust, because otherwise I'm fearful that the rates that we have seen with our vaccinations generally, what we've seen just this year compared to April of last year, we saw a 48% decrease in total vaccines administered in the state. This past May and June, we've seen a slight improvement, but we're in a tough spot right now. Give me some level of assurance, please.
I think Collins? We have a tough situation for the whole nation, but I'm sympathetic with your particular circumstances, with the history in Alaska of hesitancy being even greater. This is going to be a need for all hands on deck. Leaders in the Congress, people in the local communities have to get all together to figure out how to convey this message. The Surgeon General is right in the middle of trying to organize a lot of this effort, so maybe I should ask him to speak as well.
I mean, do we need a public relations campaign that is really amped up? Messengers are important. Who's the right messenger? Is it the Surgeon General? Is it the, you know, who is it? Because right now it's not working.
Well, we know that when it comes to vaccines and most health advice, that people will trust their local provider more than they will trust anyone else out there. So what we're trying to do is arm local providers with the facts. CDC's campaign really has scripts and sheets to help people talk about some of the frequently asked questions. We're engaging with social media influencers. So I was in Kotzebue, and they knew about rappers, and you know, in the San Francisco 49ers. I remember there was a guy wearing a San Francisco 49ers hat. We need to get Lady Gaga, for instance, is someone who I never thought I'd invoke in congressional testimony, but I gave her a shout out because she had masks that she wore at the Video Music Awards last week, and people will listen to Lady Gaga before they'll listen to the Surgeon General. So we need to very much engage. The other thing that I would implore you to think about is we need to encourage people to stop attacking the process. There's a lot of politics going on here. People don't like one party or the other, or one person or the other. the process is strong, and Dr. Collins and I have been adamant that we want people to understand there are protections built in. The process is strong. If we follow the process and people understand the process, they will have confidence. But everyone out there who says, I won't take this vaccine if, or I don't trust this vaccine unless, is instilling further hesitancy and hurting us.
Thank you,
I
Senator.
think that that's important, and that's exactly why the SAVE Act is there, is to focus on the integrity of that process. Thank you, Mr. Chairman.
Thank you, Senator.